Welcome to VedhikaTV viewers. Let us talk to Dr. Moonot. Hello, doctor.
Hello.
So, how is this diabetes related with the joint pains? Can you enlighten about that?
So diabetes directly is not related to joint pain, but again, with diabetes, you have a lot of other issues happening. And the key thing is diabetes is a multifactorial thing. It is just not your glucose or your sugars are not controlled, but at the same time, it is affecting your joints, it is affecting your nerves, it affecting your blood circulation. Indirectly, with what happens is if you have a bad or poor blood circulation, you have injuries which do not heal. You can have high risk of infection, bone infection causing osteomyelitis, and you can lose your foot or even knee or below knee amputation is very high. That is on one side. Other side is with diabetes, what happens is if there is an excessive circulation and you do not take care of your joints, there is something called as a Charcot neuropathy. Now, Charcot neuropathy, what happens is because people lose the sense of joints, they do not know where they are placing their foot, though they could be placing it anywhere. And there is a gradual destruction of both bones, joints, and ligaments. And ultimately, what happens, the whole joint becomes malaligned and destroyed. This entity is not diagnosed properly. People think this is infection, then they go to probably a general surgeon or a vascular surgeon. They are good doctors, but they are not orthopedically trained, or they are not able to diagnose this condition properly, and they think it is infection and they have it like an operation to do a debridement where we clean up the joints. Once you do this in a Charcot joint, it is a road to failure. Okay, so I would say India is the capital of diabetes in the world. The incidence of diabetes is increasing. Thereby, as orthopedic surgeon and me as a foot and ankle surgeon, my load of Charcot has increased significantly in the last 8 to 10 years. And my whole aim and purpose is to educate not only the public as well as the other, my colleagues, doctors, that diagnose this condition properly. Because if you diagnose it properly, this is a one condition which can be managed very easily and properly in early conditions. While in later part, you need big surgeries, you need a long-term care for these patients, it's a big burden on the family and the society as a whole, and the rate of success is only 80%. So that means 20% is
Risk.
risk of failure in terms of the bones not joining, the limb not aligned, risk of infection leading to amputation. That's a very, very big risk.
Okay.
So, diabetes, do take care of yourself.
My mother in law is suffering with knee joint pains, but she's scared for the knee replacement surgery. And she's saying that I don't want to get surgery, I'll be on the tablets only. Is there any other remedy other than knee replacement surgery? Please suggest on that.
So knee replacement volume has increased significantly, and yes, people's awareness has become more and more. But I think we are going swinging on the other side, where people were not having surgeries to people mild knee pain, just have surgeries. And I think there are few centers in India which we call as just knee replacement factories. I wouldn't want to name names on this, but mild arthritis knee replacement, it's a solution for end all be all. I don't think so that's the right answer. There is definitely a big gap with patients or with people who have mild arthritis, who have pains, who do take mild painkillers but is not settling down, but who are not ready for surgery or they don't need surgery. Now, what do we do for these kind of people? Of course, you always need to start with non-medical treatment in terms of non-tablet treatment. So, of course, exercise, weight loss, activities, maybe some time of knee brace or something. Change a little bit of activities. I think that is an important thing. And weight management, as I already told you, physical therapy. These are very, very important things. Then comes nutraceuticals, over-the-counter drugs you can take, glucosamine, chondroitin, rosehip extract, boswellia, curcumin. Curcumin is haldi. All these you do get over-the-counter in abroad. People have been taking it. Collagen is a new thing. No side effects or minimal side effects, can be taken easily. So these are the things which I think your mother or mother-in-law
Mother in law.
mother-in-law should
Yes.
be taking and doing it. Now, if she's already done it and still has some pain but not ready for surgery. If she's taking mild painkiller, it's okay. But I tell all my patients, they are managing with strong painkillers, okay, like NSAIDs, which can affect your kidneys, affect your liver. You can give gastritis, a big hole in your stomach. Now I tell people, you can buy a knee replacement in the market for 50, 60,000 rupees. Where are you going to buy a kidney? Who's going to give you a kidney?
True.
It is not tough, it is almost impossible.
True.
Liver, okay, if you have a liver failure, liver transplant cost is what? 75 lakhs, 1 crore or more. And to get it, and the whole lifetime suffering. It's a big thing. Instead, do other things. As I said, do this other stuff. Or if the pain is still there, then you have other options like hyaluronic gel injections. Those work very well. 6 months to 1 year is your lifespan. But if you do things which I have told you already along with the injection, it can last longer and can be repeated to an extent. To a time comes where the gel may not work. There are new modalities of treatment like your stem cell injections, and in the stem cell, what we call as a biologics. In biologics, you have something like a PRP, platelet rich plasma. You have bone marrow injections. You have a stromal cell or visceral fat injection. Visceral fat has a good supply of stem cells. Okay, so again, minimally invasive, like you can take blood from your veins, spin it, inject it, do something, take you to the operation theater, aspirate some fat or bone marrow, centrifuge it, concentrate it, and give to the knee. All are becoming new modalities of treatment. PRP in hair, face, black eyes, they've been doing it for years now. Same thing, I think, can be done safely for knee arthritis or ankle arthritis. They do work. Yes, there is evidence which is coming up. We have to explain there's a big counseling process for all my patients, which we do it. And if they are ready, I think your mother-in-law should be looking at those options as well. And there's never no harm in that. Yes, there's no 100% guarantee with this, and it works for 2-3 years, and it can be repeated again. So I think those are the things which you should be looking at.
Yeah, now my mother-in-law got many options other than knee replacement surgery. So as you said about the turmeric, till now we are concentrating on the external things like surgeries or exercising or physiotherapy. What kind of food we have to take for the strong joints or strong ankles or foot?
As I already said, exercise is very important because bone develops with stress. So the more you impact, the more it will become stronger. But along with it, you need nutrition. Good amount of nutrition is calcium, vitamin D. Calcium, good sources is milk, curd, butter, cheese. Okay, these are good sources. But people who are diabetics have to just take care what they are eating as well. Vitamin D, yes, good source is sun. You could sit in the sun, as much exposure of skin as you can for at least 1 to 2 hours, I would say in the morning, in the light sun, not too dark or something. Also, non-vegetarian sources is the fish. But what about vegetarian? I tell either you sit in the sun or have tablets. Tablets is a good source once a week, 12 weeks, I would say, and then once a month lifetime. I think that's a good thing. You need vitamin D for the calcium to get absorbed and deposited in the bone. Do not forget there are other trace elements which our bones are required, like magnesium, okay, zinc. These are two other things which are required, which you should be having on a regular basis. I would not say daily, but make sure you get that content. These are trace elements which are required. So all in all, these things should be taken care. Otherwise, no point doing other stuff. People are walking, but you don't have enough vitamin D, no point. Okay, that's what is important.
Parents are stressing on the children to be actively participate in the physical activities, mostly in the outdoor activities, because most of the children are addicted to the mobiles or TV. So what about the children who are actively participating in sports? What kind of injuries do they face and what are the remedies for them?
Yes, you should be pushy to your child, but make sure that you push in the right way. And as I said before, yes, you do your workload management, you push them, you strengthen them, but at the same time, focus on their balance, proprioception, their workload management. Give them time to recover. Okay, friend of mine whose daughter is now going into national tennis, I think she's been too pushy. The workload, there is a time where she is not able to do it because her shoulders hurt. we need time to take off for her to recover. Also, we need to get them access to cool baths or a ice sauna. I think that's a very good thing. So that's another workload management. Other coming to knees, make sure that they are aligned properly. Yes, you cannot change what the alignment is, but flat foot is another big thing. Okay, 20% of people in India are flat footed. Not everybody has symptoms. But if you're really going into active sports and your knees or your back starts hurting or your feet start hurting, you really need to look what you are doing in your footwear issues. Are you using the appropriate footwear? Are you using insoles or customized insoles? Have you been doing proper exercises for your flat foot? Those are very, very important things to consider, and especially people who are going towards a professional side. That's very, very important.
Recent developments related with the rheumatoid foot. Can you please enlighten on that?
Rheumatoid arthritis, I don't know if you guys know, it's like an autoimmune disease where your own blood or a body produces antibodies which goes and destroys your joints and ligaments and the cartilage. And that's a very basic understanding of stuff. And people come with joint pains, joint swelling, could be one joint or it could be multiple joints, usually affecting the hand and the small joints. But in foot and ankle, it affects the whole foot and can be ankle as well. So recently, because of the medical advances in rheumatology or rheumatoid arthritis management, we are not seeing as bad deformities which we were seeing 10 to 15 years ago. But again, we have a lot of people have burnout rheumatoid arthritis but bad deformities. In the past, we had big open surgeries where we had to do big scars and we had to take out the heads of the metatarsals and get the toe corrected. It was a big surgery where people took almost 6 months to recover. But with the advent of what we call as a minimally invasive surgery in foot and ankle, where we do a lot of corrections of the deformities or the deformed toes by small cuts, like a less than a centimeter cuts, we can correct the whole foot deformity. That has really changed the management of patients with rheumatoid arthritis feet. I was the first one to introduce minimally invasive surgery in India. I got trained both in US and Europe and had surgeons coming and giving me hands-on training as well. So I've been fortunate. We've been doing that for the last 3 years in India, and we have got fantastic and great results for patients with rheumatological conditions and also other conditions like in diabetes, like in corns, callosities, or other deformities of the foot, where minimally invasive surgery works very well for them.
Thank you so much, doctor, for sharing us this valuable information. Thank you once again.
Thank you so much for having me on this show. I hope the viewers have found all the information useful. If there's anything, they can always contact us. Thank you.